Hello, Dr. Arjun here, practicing nephrologist at ILS Hospital, Howrah. So today I will be talking about preventive nephrology. So how you can stop your kidneys from getting worsened day by day. A patient who is suffering from hypertension or diabetes will have a kidney function problem at any stage of your disease. So maybe a person who is suffering from diabetes, 5 years or 10 years duration, he will start leaking protein in the urine. He may develop swelling of the lower limb. He may pass sometimes the bloody urine, or sometimes there can be a complaint of passing urine frequently at night. So you need to visit your doctors, preferably a nephrologist. If it is required, then we may actually see to go undergo some tests, some preventive tests like the calcium phosphate uric acid, and if required, we may also go ahead with doing the kidney biopsy for those patients. Because suppose a patient is suffering from diabetes, we think he is having diabetic nephropathy, but he may also have an underlying FSGS, focal segmental glomerulosclerosis, or IgA nephropathy, which may go undiagnosed. So in those patients, we may need to undergo kidney biopsy. We are doing kidney biopsy regularly out here at ILS Howrah, which is not being done regularly at the other centers. So who need to undergo kidney biopsy? Suppose you are having a sudden jump in the worsening of the kidney function. Suppose your creatinine was 1.5, it went to 3 suddenly without any infection or dehydration or other causes. Secondly, if you are having active sediments in the urine, suppose you are not passing any blood in the urine, but your urine microscopy test, routine test is showing blood in the urine, you have to undergo kidney biopsy. Even without infection, you are passing blood in the urine which is being found in microscopy. Third, if the protein leaking in your urine is more than 10 gram, then you need to undergo a kidney biopsy. So if we can have the kidney biopsy result, then maybe the other disease like FSGS or IgA nephropathy, which you are harboring alongside diabetes, that needs to be taken care of, which will be missed if you don't undergo kidney biopsy. So preventive nephrology is one of the newer avenues where we can find out the exact cause of the kidney disease by undergoing this kidney biopsy, bring the autoimmune test panel like ANA, C3, C4, MPO, PR3, ANCA, and TGBM antibody. Because in the female population, those of the age of less than 40, there is a high chance of SLE nephropathy, lupus nephritis. Even male patients suffering from lupus nephritis, because autoimmune disease is sometimes being missed. Supposedly your creatinine is 1.5, you are undergoing the normal routine blood test and you are doing creatinine every 1 or 2 months and it is on the rising trend, but the diagnosis is being missed because you are not undergoing the other test which we need to do at the early stage of the disease or doing the kidney biopsy. So we will try to halt your kidney disease at the very incipient stage. Suppose your creatinine of 1.5 or 2, when we can revert the disease. But if the creatinine is already 4 or 5, then supposedly it is out of hand. So come to visit your doctor early, and if required, come to us. We'll see how your kidney can be managed holistically, and we'll try to revert it, and we'll try to slow down the progression, and to need to find out the exact cause of your kidney diseases. Thank you.